Welcome to UMCC Medical Consultant Connector, where your health matters to us. Anemia is a common blood condition. It happens when your body doesn't have enough healthy red blood cells. These cells are vital as they carry oxygen throughout your body. Think of them as tiny delivery trucks, ensuring your organs and tissues get the oxygen they need to function correctly. When you have anemia, your body may not get enough oxygen, leading to fatigue and other health problems. Anemia affects millions of people worldwide. It's important to understand anemia because it can affect anyone, regardless of age, gender, or ethnicity. While some forms of anemia are mild and easily treatable, others can be more serious and require ongoing management. Knowing the causes, symptoms, and treatment options can empower individuals to take charge of their health. Anemia can stem from various factors, often categorized into three main groups: decreased red blood cell production, increased red blood cell destruction, or blood loss. Let's delve into some common culprits. One of the most prevalent causes is iron deficiency. Iron is crucial for producing hemoglobin, the protein in red blood cells that carries oxygen. Without enough iron, your body struggles to make enough healthy red blood cells. Other deficiencies, such as vitamin B12 or folate deficiency, can also hinder red blood cell production. Sometimes our bodies destroy red blood cells faster than they can be made. This is known as hemolytic anemia. It can be inherited or caused by autoimmune disorders, infections, or certain medications. Certain chronic diseases like kidney disease or cancer can also interfere with red blood cell production, leading to anemia. Anemia can manifest in various ways, with symptoms ranging from mild to severe. Some people may not experience any noticeable symptoms, especially in the early stages. However, as the condition progresses, telltale signs often emerge. Fatigue is one of the most common symptoms of anemia. When your body lacks sufficient red blood cells to transport oxygen efficiently, you may feel constantly tired and weak, even after a good night's sleep. Shortness of breath is another frequent complaint. Since your muscles aren't receiving enough oxygen, simple activities like climbing stairs or walking short distances can leave you gasping for air. Anemia can also affect your appearance. Pale skin, particularly around the face, hands, and inside the lower eyelids, is a classic sign. This paleness occurs because hemoglobin, the protein that gives blood its red color, is reduced in anemia. Other visible symptoms include brittle nails, dizziness, headaches, and cold hands and feet. Section 4. Unmasking anemia, diagnosis and testing. Diagnosing anemia begins with a simple blood test called a complete blood count or CBC. This test measures various components of your blood, including the number of red blood cells, their size, and the amount of hemoglobin they contain. Your doctor will review your medical history, asking about your diet, medications, and any family history of anemia. Based on your symptoms and the initial CBC results, further tests may be recommended to pinpoint the underlying cause of your anemia. For instance, if iron deficiency is suspected, your doctor might order additional blood tests to check your iron levels. If the cause isn't immediately apparent, a bone marrow examination might be necessary. The bone marrow is where red blood cells are produced, and examining it can help identify problems with blood cell production. Section 5. A shield against anemia prevention strategies. While not all types of anemia are preventable, adopting a healthy lifestyle and diet can significantly reduce your risk. Iron deficiency anemia in particular can often be avoided through dietary changes. Consuming iron-rich foods is crucial. Red meat, fish, poultry, beans, lentils, and leafy green vegetables are excellent sources of iron. Combining these foods with vitamin C-rich options like citrus fruits, tomatoes, and peppers can enhance iron absorption. If you're at risk of vitamin B12 deficiency, such as vegans and older adults, ensure you're getting enough from fortified foods or supplements. Folate deficiency can be prevented by consuming folate-rich foods like leafy green vegetables, citrus fruits, and beans, or taking folic acid supplements. Section 6. Restoring balance. Treatment for anemia. Treating anemia involves addressing the underlying cause. For instance, if iron deficiency is the culprit, iron supplements and dietary changes are typically recommended. In cases of vitamin B12 or folate deficiency, supplementation is usually the first line of treatment. For anemia caused by blood loss, such as heavy menstrual bleeding or internal bleeding, identifying and controlling the source of bleeding is essential. Depending on the severity, blood transfusions might be necessary to replenish red blood cells quickly. Treatment for anemia caused by chronic diseases focuses on managing the underlying condition. Medications, such as erythropoietin, may be prescribed to stimulate red blood cell production. It's important to remember that self-treating anemia can be dangerous. Always consult with your doctor for an accurate diagnosis and a personalized treatment plan. UMCC, your ultimate medical consultants connector.